What are bone markers, and how do they help osteoporosis treatment? Imagine being able to see how your bones are doing inside your body without any invasive procedures. That's where bone markers come into play. Bone markers, also called bone turnover markers, are proteins or their fragments released into your blood or urine during the natural process of bone remodeling. Bone remodeling is a continuous cycle where old bone is broken down by cells called osteoclasts, and new bone is built by cells called osteoblasts. These markers give us a snapshot of how fast this process is happening at any given time. In osteoporosis, where bones become weaker and more prone to fractures, understanding how quickly bone is being lost or rebuilt is crucial. Bone density scans tell us how much bone you have, but they don't tell us how actively your bones are turning over. Bone markers fill this gap by showing the rate of bone resorption and formation, giving a more complete picture of bone health. These markers are especially helpful in several ways. First, they can detect increased bone turnover early, even before significant bone loss appears on scans. This early warning can help identify people at higher risk for fractures sooner. Second, bone markers respond quickly to treatment. When you start medications like bisphosphonates or hormone therapy, a drop in resorption markers often indicates that the treatment is working to slow down bone loss. This rapid feedback helps doctors know whether the therapy is effective or if adjustments are needed. Another benefit is that bone markers can confirm if patients are sticking to their medication plans. Since these markers change rapidly with treatment, they can show whether someone is taking their medication regularly. If the markers don't change as expected, it might suggest the treatment isn't working well, or there could be other factors affecting bone health, prompting further investigation. Common bone markers include resorption markers like C-terminal teloptide of type 1 collagen and enteloptide, which reflected how much bone is being broken down. On the other hand, formation markers like procollagen type 1N propeptide and bone-specific alkaline phosphatase indicate new bone being formed. These are measured through simple blood or urine tests, making them easy to repeat over time to monitor progress. It's important to remember that many factors can influence bone marker levels, such as age, gender, time of day, recent fractures, or other health conditions. Because of this, interpreting these markers requires a healthcare professional's expertise and should always be considered alongside other diagnostic tools like bone density scans. In summary, bone markers are valuable biochemical tools that help us understand the dynamic process of bone turnover. They enable earlier detection of osteoporosis, monitor how well treatments are working, ensure medication adherence, and guide personalized treatment plans. When used thoughtfully alongside other assessments, they can significantly improve how we manage and treat osteoporosis, helping people maintain stronger, healthier bones for longer. Always consult your healthcare provider for personalized advice and interpretation of these tests.